My name is Conal Austin and I'm a paediatric adult heart surgeon who works at St Thomas's Hospital in London. And we've been coming out here to Sri Lanka for the past 23 years to do children's heart surgery. We have been coming to Galle and the Karapitiya Hospital, which is now the National Hospital of Galle, for the past 20 years. So 2005 was our first trip to Karapitiya. I love coming out to Sri Lanka because we bring a team of about 14, 15 people from London, nurses, anaesthetists, intensive care unit staff and surgeons that come and do the heart operations.
So we have with us today Dersika, who is our contact here at the Jetwing Lighthouse Hotel in Galle. A wonderful hotel that the Take Heart Mercy Mission team have been coming to for many, many years now. The hotel have always looked after us really well. And their friendliness and their support for Take Heart has been immense. And we're very grateful to Dersika for that support.
Very honoured to have you with us this year again. And thank you for your incredible work that you are doing in the community. And Jetwing Lighthouse is now almost 28 years old property. It is done by very famous architect, Mr. Jeffrey Bauer. We always welcome this group every year to Jetwing Lighthouse. And we are always, I hope that you all feel like home here.
I've been fortunate enough to come on the Take Heart Mercy Mission quite a few times before, and it's a very, very important part of my life. I am able to take a little bit of time out of busy work and family life schedule and come out to Sri Lanka and give a little bit back to the local community, and I'm very privileged to be able to do that. The hospitality and the kindness shown by the local staff is incredible. I always have a sense of pride and also almost belonging when I walk into the unit and I'm welcomed with open arms and smiles. It really, really is incredible experience.
Hello, my name is Saib. I'm one of the PIC nurses. This trip has been absolutely incredible. It's been my first year here and I have learned so much. The local team have been absolutely incredible. I think it's amazing to see. It's very different from home, so I think it's been such an incredible experience. Just seeing how resilient the team has been. It's been quite tough this year, but it's been amazing. We've had some incredible children, some great local nurses. Everyone's been super supportive and really, really friendly. It's been such a great experience.
So we've got the team here. Anna's going to be my surgical trainee. Aidan's working in the heart-lung bypass machine. And Dr. Dev Patani is our anaesthetist. We've all been on these trips before, so we know each other well. And we are a team that works together at St Thomas's Hospital in London. So we're going to get started very, very shortly. This is our first day back at Karapitiya Hospital. It's September 2025. And we came into the hospital yesterday on the day that we arrived. We've identified 3 patients that we're going to do heart surgery on today, at least we hope so. So the first patient today is a child that's 1 month away from being 2 years of age. So 1 year and 11 months old. Baby's quite small at 10 kilograms. And the baby has got a heart condition which makes the child quite blue when she exercises. So when she exercises, she doesn't get enough blood flow through to the lungs. And we're going to rectify that today. It's called tetralogy of Fallot. We've done a lot of tetralogy of Fallot operations here over the past 22 years.
My name is Dev Matani and I'm a consultant anaesthetist. I've been part of the Take Heart team for several years now, coming out here to Sri Lanka, and it's always remarkable just how welcoming and helpful the local teams of doctors and nurses are when we come out here, and more so just how appreciative they are of the work we do. We couldn't do this sort of work without help from our donors. We are a charity and we rely on people supporting us, and it's been amazing how generous people can be when they know what we do.
My name is Kasia. I'm a cardiac scrub nurse. This is my second year coming here to Sri Lanka, and it has been an amazing experience. Again, it's a huge pleasure to work with the local team. They are extremely welcoming, very hardworking people.
Hi, I'm Jane. I'm one of the sisters who takes part in the Take Heart team. We've just arrived this morning and we have got lots of donations from companies in the UK which supply us with goods that help make what we're doing better. We're a team of nurses and doctors from the PICU and the Evelina Children's Hospital, so we work together all the time. There's one girl who's new this year, so we're just introducing her slowly through it. The first child is in theatre, expected to return here in about 2 hours' time. So by then we'll be set up and ready to take them back from theatre. The local nursing team here are very involved in helping us with the care and helping us to set up and providing us things so that we can do it as we like to do. I have been on the trip every year from the very beginning, so this shows what a huge impact it has on my life and how it has impacted also on my professional development.
This is my third time on the trip, and it never ceases to amaze me how quickly the children can recover from the surgery. In the morning they can have open heart surgery, and by the afternoon they're up, sitting, drinking water and having their parents there. It's really amazing.
Hello there, I'm John Simpson. I'm a paediatric cardiologist on the Take Heart mission. The challenges which we have, it's always difficult to go to a different unit, one that maybe you're less familiar with, but we have been coming here for 20 years and we manage those challenges, I think, as a team pretty well, and we adapt to the situation as we find it.
My name is Rachel Carnell. I'm a paediatric cardiologist from Newcastle in the UK. My favourite thing about these trips is seeing the patients for their follow-up. The heart problems that they have really impact on their life. They don't grow, they're very breathless, very blue. And we come here and more often than not completely repair their heart. One particular child I can think of who we saw on this trip had a heart operation a year ago and doubled in size, went from 52 centimetres to 120 centimetres as we record their demographics. It's phenomenal. It makes a massive difference to these kids.
The trip this year was quite hard for me. I had some quite difficult experiences, but the thing that stood out to me the most was the resilience of the patients and families in the hospital. Resilience of the staff there and what they have to work with, and the resilience of the team here and how much we all pulled together even though we'd had some difficulties. And I was also surprised about the resilience of myself, that even though I was finding it quite difficult, that I managed to put it together, go to all my shifts and did my job.
For 22 years now, Take Heart Mercy Mission has been coming to Sri Lanka. We've been very privileged to come to the Karapatia Hospital, and along with a medical team from the London Evelina Children's Hospital, we have brought approximately 17 to 20 medics each year, and we've carried out over 300 operations on critically sick Sri Lankan children, all conducted by volunteers who have given up their time and their money and their holidays to come here for the mission. So we've enjoyed a long 22 years. We look forward to working with the Minister and Dr. Ranga and other officials in developing more paediatric surgery here in Sri Lanka. And we're very privileged and grateful that the Minister has taken his time today to come down and visit our work. And on behalf of myself and my two other trustees, Professor John Simpson and Dr. Conor Lostin, we thank you very much, and we look forward to working here in Sri Lanka, helping develop paediatric surgery more, training other paediatricians and consultants here in Sri Lanka, and indeed taking it to another level. So again, thank you very much, Minister, for coming down, and thank you very much for inviting us.
Yes, I would like to extend our appreciation to their greatest work. Actually, it's very appreciated one, because this very difficult task as a nation to Sri Lanka to treat such a complex cardiothoracic surgery. We have no some facilities, and especially we have no skilled person to do such operations. So there is a very valuable gift for us, our children, and it's a very great thing, because they did this operation silently in last 22 years. So suddenly we decided to explore this service to public.
We're very fortunate to Dr. Tulisha's staff and the colleagues to have the facilities where they don't usually operate on children with such complex congenital heart disease, and also with this size of babies normally. You know, I've been coming to Sri Lanka with the team for many years, and you know, when we first came, we didn't even have access to pacemakers. So it's great that there's been advancements, and we can help the people.
My name is Paul Scally. I'm the chairman of the Trust for Take Heart Mercy Mission. It's been an incredible trip this year down here in Sri Lanka. Some many memorable moments and some very sad moments, but certainly the memorable moments have been the children that have come into surgery with their families and had surgery which has been successful, and seen them in intensive care, sitting up, walking in some cases, and then moving out to the main ward where they've been well looked after, and in 2 cases yesterday they left hospital. So yeah, that's been my most memorable moments in this trip. It has impacted all our lives. I think we work very closely as a team. They're a very professional team from the London Evelina Hospital that come down here to Sri Lanka, which is quite amazing when you consider the amount of work that goes into heart surgery.
This child has got a heart condition which makes the baby blue. So there's a restriction in the blood that goes to the lungs. There's a hole inside the heart. It's called tetralogy of Fallot. So we're going to close the hole in the heart, fix that with a patch, and then I'm going to open up the outlet of the blood going to the lungs. It's actually got a nice sized pulmonary artery, but I can feel the turbulence of the blood flow going through the pulmonary valve. It's a bit like when you put your hand on a cat, you can feel a cat purring. The same sort of thing, there's a turbulent blood flow of the blood going through the pulmonary valve, which is stenotic there. Do you want to feel that there, Marta? So put your finger over the pulmonary artery and you can feel that sort of purring.
The greatest highlight for me has been witnessing our team working together despite limited resources, providing safe care, collaboration between professionals, bringing our own skill, working together towards the same shared goal was truly inspiring.
Aidan is our perfusionist for Take Heart. and he's going to explain now how his equipment works and how, when the heart is stopped, the body keeps working.
So essentially what we do is we put some cannula around the heart and then we drain the blood from the body, which is deoxygenated. We provide oxygen to that blood and remove CO2 and then return it back to the patient, therefore keeping the circulation going. We can then give a solution to stop the heart so the surgeon can operate on it while it's still, and making the operation a bit easier for him. And then we warm the patient back up and then separate from the machine.
So the highlight of the trip for me was coming back to the hospital and meeting the local team and the enthusiasm they had for working with us, and it was really good, really fantastic.
Deb is our anaesthetist at Take Heart, been coming for a number of years, and a very, very qualified anaesthetist working out of the Evelina Children's Hospital in London. And without Deb, nothing could happen. Without any of the team, nothing could happen here. So Deb's going to talk you through how his job works.
So my role, as Paul said, is I'm the anaesthetist for the trip. So essentially, I'm here to make sure that the patients are obviously completely asleep and unaware of what's going on during the procedure, but more importantly, because of their complex heart disease, there's quite a lot of meticulous detail to attention in terms of how we give the drugs, keep them safe, complex monitoring during the procedure, and then delivering the patient safely back to intensive care for ongoing treatment. And it's something that I love doing. I've been doing it at the Evelina with the same team for many years now, and I think 10 years I've been here with Chain of Hope.
Great to have you, Deb. Thank you.
So we're going to get this baby fixed up for today. It'll take us about another 2 hours. We have to use the heart-lung bypass machine here, which Aidan, who you met earlier on, he's arranging that for us. And we're just about to put the pipes into the heart to start the surgery.
My name is Anna, and I'm a Senior Cardiac Surgery Fellow from Evelina Hospital in London, and I'm one of the surgeons of this trip. To me, the highlight of this trip so far has been the excitement of coming here together again, to repeat the experience of the past years. I think everybody was very excited to come back, given how the experiences from the other years, and we were really looking forward to this trip. And to me, what has surprised me more, I would say, the team, the local team, and how they have been involved and how they have helped us, how they have welcomed us. We wouldn't have been able to do it without them.
We're just now coming around to pack up and say goodbye to the patients, the staff, do the necessities that obviously at the end of the trip you have to do. And Dr. Andrew Nyman's here, who's been looking after the intensive care unit all night, and he's going to tell us and talk to Imana for us.
Thanks, Paul. Imana it's a great success story. We as a team operated on her many years ago. She's got very complex congenital heart disease, and she came back to our team this time around, and we completed this set of operations called the Fontan procedure, and she's done very well and good.
Yeah, we wish you well. Thank you.
All the best.
All the very best.
This is Kartik. He's the 11-year-old boy who had Epstein's anomaly.
There's a relatively new operation that's been out for about 15 years called the cone repair. And it's quite a technical operation to repair the tricuspid valve. I don't think there's anybody in Sri Lanka currently doing that operation, so we're really grateful for the opportunity from the staff from the Lady Ridgeway Hospital in Colombo, who sent this young fellow down for his operation. So he's had a cone repair. He came to us with a very dilated tricuspid valve annulus. At about 5.1 centimetres. It's now about 2.5 centimetres, so it's dramatically reduced in size. And the leaflet tissue that was there in his tricuspid valve, I've refashioned that to make a new valve, and that valve is working very, very well. Also, the right ventricle, the major pump that pumps the blood to the lungs, was very thin, which is part of the condition, and we call that atrialization of the right ventricle. And in him, what I did was I excised that. So I cut all that thin-walled right atrium out, because it's better to have a smaller ventricle, which is much more efficient, than a big baggy ventricle that has to fill with a lot of blood and just generally not as efficient. So he's had a nice repair. I think we did him 3 days ago now. I've just seen the echo done by John Simpson and Rachel, and he's got a mild leak in the valve, which is just perfect, and it's stable. and it'll stay like that for a long time. So the results of the cone repair are very, very good. And I was just saying to Geith, the cardiologist here, this is a really good example of working between what we can offer in terms of teaching cone repairs or doing cone repairs and getting the patients. So I was saying that if we could get more Epstein repairs for cone repairs for the trip next year, that would be good, and we could get some of those local surgeons down from Hospital.
Yeah, I think that would be a great idea. I mean, he's surprised us.
Yeah.
He's almost ready to go home.
He is, yes.
He's had a really smooth post-operative course.
That was good.
It's very good.
So we're happy. Thank you.
What I will remember from this trip is, because of the type of work that we do, there's always very much to be some sadness, which there was again this year. But the most important thing for me is at the end of the trip where we visit our children that have pulled through and done really, really well and are smiling at us. And we get such lovely hugs from the parents and the grandparents. So grateful for what we've done. And that just inspires us all to come back.
This is Shadi, she's 17 years old, and Miss Rostin did a valve surgery on her.
Yes, thanks Jenny. So she's a lovely girl. I know this girl because I operated on her when she was 2 years of age. So 15 years ago on one of the trips here to Karapatia a long time ago. And at that stage she had a small hole between the two major pumping chambers in the heart, but a much bigger hole between the low pressure pumping chambers in the heart. So much so that she had a common atrium. And at that stage, she had a defect in her mitral valve, which we repaired. But over the years, that's becoming a little bit more floppy, and it's becoming progressively more regurgitant, so it leaks, the valve leaks. And she was getting symptomatic for that. The right atrium was very dilated. So we made a decision to reoperate on her, and I was planning to do a redo repair on the valve. But the minute I opened up the heart and had a look at the valve, I just found that it was very thickened, fibrotic, it was dysplastic, we call it that. So it's not normally formed. And in fact, it had two openings into it rather than just one big major opening. So I did try and repair it, just spent about an hour trying to repair it, reducing the size of the valve down. And whilst it looked better, it wasn't perfect. And I couldn't really afford to leave her with a less than adequate repair, because that would possibly necessitate a further reoperation again within a year or two. So I made the decision during the operation to replace the valve, to excise the valve and replace it with a mechanical valve. And we were lucky because the hospital here has got some good consignments of heart valves, and we put in a mechanical valve about 3 days ago. And she's doing well. She will have to go onto a blood thinning medication for the rest of her life, otherwise she can develop blood clots in the mechanical valve. And that's one of the reasons why you try to do repairs rather than valve replacements. But we had no option but to replace the valve with a mechanical valve, and she will do very, very well.
She's been really brave. She's on the road to recovery, so it's all good.
This 4-year-old boy has a condition called tetralogy of Fallot, which has been operated on 2 days ago. So that means he has a hole within his heart which needs to be closed, and he has obstruction to blood flow to his lungs which needs to be relieved. So we're scanning him today as we would do normally. Shows he's got good heart function, only a tiny little residual VSD which is normal, and no obstruction to his lungs. So he should have a durable repair which should do him right into the long term, and we'd be very hopeful he wouldn't need anything further done for his heart.
In essence, what I do is I set up and service the kitchen at the hospital, make sure that the medics there are properly fed and watered, and other things as required, such as going out for medicines which may not be available within the hospital pharmacy. The high point was seeing these wonderful individuals with such great passion, professionalism, lifting themselves individually and coming together as a team. to effect what they're here to do, and that's to save lives, and that gives you great heart. And I take away from all of that a reinforcement in my faith in humankind and just what is important in the world.
So now that Menushi is 15 years old, how would you describe her quality of life now she's had her heart surgery?
Now Menushi is 15 years old. Now she's doing better and she's 100% okay. She's doing sports and education. She's very talented girl and now she's living like a normal life like other children. Thanks to you.
Menushi, I'd like to thank you very, very much for coming all the way from Colombo to talk with us today. It's been a privilege. It was wonderful to see your daughter develop, and we saw her last year. So if you had a message to take heart, what would your message be as a final question?
Actually, we are very poor people in Sri Lanka and you are doing a great job for all the Sri Lankan people and who cannot afford the money for this kind of surgery, because if we are not meet you, we cannot do this operation because my baby that time is very critical situation. So you are like a god and thank you so much, and we don't know how to thank to you, and thank you so much, and thank you very much for doing this great job for the people in Sri Lanka. That is very kind of you.
When you leave school, what will your aims and dreams be for the future, for your career, your life?
ඇත්තටම මම දන්නේ ලංකාවේ අවුරුදු කීයෙන්ද කියලා ඉස්කෝලේ යන life එක ඉවර වෙන්නේ. Now I'm in grade 11 and then after the O-level I want to do a course and I want to be a doctor. After I want to study hard. So my dream is I want to be a doctor.
Menushi, this is good news that you want to be a doctor and a heart doctor as well, which is excellent. Why is it that you want to become a doctor in Sri Lanka?
I want to be a doctor because when I was a baby, you came to our country and you did the great job, and we are very poor, and so I want to be a doctor. Then I can also help to the kids who have heart problem like you, so I can give the best service to the Sri Lankan people.
So finally, thank you for coming to see us. It's lovely to see you and the family again. What would be your message to Take Heart Mercy Mission and to all the medical team that have come here to Sri Lanka?
You are doing a great job with your team and you save so many babies' life like me, and I wish every year you to come and do the good service to the Sri Lanka. After the successful surgeries for the hospital team, they want to give a small souvenir to the team for the appreciation.
Thank you for this great service to our nation, sir.
The highlight of my trips is always seeing the patients that we've operated on previous years coming back with their families when they've completely recovered. A lot of them have great stories about how having heart surgery and having the heart repaired has transformed the life of both the child and the family.
It's been a fantastic week, really special. I think it's been quite challenging as well, and professionally for me, that's a really good thing. There's always something to learn coming here, and although we're doing the same jobs on paper that we do at home, it's a completely different environment and a different setup here, and we're working with obviously the local team as well, which is just a fabulous learning experience for us. The learning goes both ways and we always feel so grateful at the end of the week.
Over the years, we've managed to teach and educate some of our colleagues here, and that is really nice to see, and it's something that we are particularly proud of.
This is the second time I'm involved in this particular great project. So this time too, the same feelings, we had a really nice time. So our kids and some adults all were underwent lot of like difficult, complicated surgeries, and like they are having their lives back. So I'm really grateful, and I'd like to apologize for any inconvenience during this period. So like it will be wonderful to see you back soon.
This time we've done 16 babies that have got complex cardiac surgery. And one of the important bits about the trip on this occasion was that we were operating on patients that had been sent from the principal cardiac unit in Sri Lanka, which is called the Lady Ridgeway Hospital. And we operated on 5 children that had been referred from the doctors and surgeons at the Lady Ridgeway Hospital. So that collaboration with the local team has been absolutely one of the best bits of the trip so far.
It's a very rewarding charity. It's a charity that raises funds through volunteers, and that's the way we're able to bring the team down here to the hospital in Gaul. And so yeah, I'd just like to thank all those that have donated over the years and for this trip as well. And just to say how much those donations are much needed, and each year those donations pay for the trips that allow us to come down here and save lives. So thank you to all our sponsors. Please keep sponsoring, whether it's any amount is helpful. And we look forward to coming back here in 2026.